What are the steps for the treatment of a spine TB patient? This video is going to be all about this. If we talk about a normal patient, normal human being, unfortunately he may end up with a spine TB. Now we'll be explaining the steps which can help him to go back to his previous pre-diseased normal human state. Step 1. Step 1 is diagnosing the problem. That means we have to first of all identify and make it clear that it's a spine TB or not. There are three ways of doing it. Number one is a clinical examination, which involves a patient being checked by the specialist doctor for the various signs and symptoms of spine tuberculosis. And at the same time, doctor may advise certain blood tests, certain X-rays or MRIs or CT scans and certain other tests to confirm the complete picture matches with spine TB. Step number 2. Once a doctor or a treatment provider is sure that it falls in the category of spine TB, then before starting treatment, it should be 100% confirmed, because the treatment for spine TB lasts for 1 to 1.5 years. We should not and we cannot give medicines without confirming it's spine TB or not. So for step 2, to get 100% confirmation, we take out the sample of the diseased part and send it for examination for the presence or absence of the bacteria which causes spine TB or for the other signs. This is medically called as biopsy. As we have talked in previous videos, biopsy has been revolutionized by endoscopic techniques also. So once the patient has passed through step 1 and step 2 and we are now 100% sure that it's a spine TB, we move to the step 3. That means choosing the most appropriate treatment for the patients. For the spine TB patients, treatment has three components. Number 1 is the nutritional support. That means patient has to have a good nutritional support in terms of proteins, fats and other components so that they get the power, immunity to deal with the deadly bacteria which is Mycobacterium tuberculosis. Secondly, medicines. WHO and government has standardized the medicine protocols. They have been divided into simple TB, MDR TB and XDR TBs, and accordingly, according to the reports of biopsy, we start the patients on the specified regime, which gives absolutely good results. Now, only 5% of the whole patients may have some kind of neurological weakness in which their arms or legs get weak, or they lose power, they lose sensation, or sometimes they may have problem with passing urine or motion. These cases require surgical correction, or in the sense they require surgical treatment of the spine TB, which is itself a detailed topic which will be dealt in another video. So as I told you, there are three steps of treating a spine TB patient. Number 1, very good clinical examination by a specialist doctor to confirm whether it's spine TB or not. Step 2 is the biopsy to make 100% sure that this is spine TB. And step 3, after grading and staging the spine TB, giving the appropriate treatment. By doing all these three processes in a synchronized manner, in a proper manner, 99.9% of the patients go back to the normal lifestyle in a very in a quick manner. So friends, please remember this. Try to spread this video to the patients, to your loved ones who are suffering from spine TB and seeking for the right solution. Thank you. We care about you.